Good evening, ladies and gentlemen. Thank you so much for joining us on this webinar today. Kindly give us about 5 minutes as the doctor is trying to sign in and join. Once he joins in, I will let you know, then we can begin the webinar. In the meantime, you can start at the question and answer area. Please start typing in your questions because this is a purely Q&A session. So the doctor will not talk much. He will be answering your questions. So you can start typing in your questions in the Q&A session so that when he comes in, we can immediately begin answering your questions. So thank you so much. I'm looking forward to engaging.
Good evening.
Good evening, Doc. How are you?
Fine.
I was trying to send you the ID. I was trying to send you the ID on your SMS, but thank God you're here.
Okay.
So let me just start the meeting. I will introduce you, and then we have a couple of questions that have already come in. We already have a couple of attendees, and then now I'll be reading out the questions, then you can respond to them.
Okay.
So ladies and gentlemen, thank you for your patience. Sorry, we are a bit, we started a few minutes late, but the doctor is here, we thank God. So as we had announced in our communication to you, today we are going to discuss matters women's health, especially the reproductive health of the woman. And this first session is all about question and answer. So all the questions that you have had regarding your reproductive health or areas regarding women's health, please ask all the questions. The doctor will be responding to you. With us this evening is Dr. Frank Kagema, who's an consultant obstetric gynecologist. I hope I've pronounced that well. He has worked with AR Insurance for a long time and is a renowned consultant in the areas of reproductive health of women in consultation. So we have an expert in the panel today to answer your questions. Please feel free, ask all the questions that you need to be asked for the next 1 hour so that we can have an interactive session. Now, because this is a webinar, you will not be able to talk. So you can only put your questions on the Q&A at the bottom, at the chat area. So type your questions and then I'll be reading them out and the doctor will be answering them. So thank you so much. Daktari Karibu, maybe you can introduce yourself a little bit, tell us more about yourself before we start answering the questions.
Okay, thank you very much. My name, as you've heard, is Dr. Frank Kagema. I'm a consultant obstetrician and gynecologist working in Nairobi. My office is in Hurlingham, and I work with several hospitals, but my clinic is in Hurlingham.
Okay. So in case you want to go and visit the doctor, his clinic is in Hurlingham, you can go and see him. So Dr. there are a couple of questions that have come in. Of course, this area of reproductive health is an interesting area, and all of us as women, we are keen on ensuring that our health is spick and span. Our first question is as follows. The member has a child. They have one child. They got a miscarriage in 2015. Since then, they have been trying to conceive, again, following correctly their safe days, but to date, they are not successful. So what could be the problem?
That's a good question. And I must say that we get a lot of such clients who come to us where maybe you had a miscarriage 1 year, 2 years, 6 months ago. Of course, anytime you have had a miscarriage, it's always important to conceive as quickly as possible so that even the women can heal psychologically.
Yes.
And 2015 is about 5 years ago, and they have been trying to conceive. It's important now for them to go to a gynecologist and have some important tests done to make sure that is the womb fine, are the tubes okay, does the man have enough sperm count, are they counting their days properly? So they need to go back to basics and to know is their reproductive health up to scratch so that they're able to conceive maybe without any medication. And there are important tests that can be done. One of them can do an ultrasound of the uterus. You can do the fallopian tube test. There's an X-ray for that. You also do a hormonal profile. And for the man, usually the best thing is to do a sperm count.
Okay.
That usually is the basics.
Okay. Okay. Thank you. So the person who's asked that question, please visit a gynecologist. You can visit Dr. Kagema so that he can take you through. Now, someone else has a question here. What are the best remedies for period pains? Normal painkillers don't work. They are 43 years, no children.
You always find that painful periods is called dysmenorrhea. And it's common amongst especially young ladies, especially below the age of 25. That's the time you have a lot of women presenting with painful periods. So anytime you get painful periods, especially after the age of 25, it's always good to go to your doctor and really have yourself checked to find out what else could be causing that period pain. Could it be maybe an infection? Could it be something called endometriosis? Could it be fibroids? Could it be, even ovarian problems? So it's good for her to have a proper thorough checkup to make sure that there's nothing else which is also causing that period pains to come.
Okay. Hi, doctor. Mine is a concern. Is it normal to have a cycle in 21 days? If yes, what health risks can it cause?
Good question. Now, about menstrual cycle, two important things I would like to educate my viewers is this. One, menses should never last more than 7 days. And they should not be less than 2 days, unless, of course, you are using a hormonal method.
Okay.
Number two, the normal cycle length is between 21 days to 35 days. So that we worry if your cycle is above 35 days and if it is less than 21 days. So if you have 21-day cycle, that's normal. If you have 24-day cycle, that is normal. We worry if you have a less than 21 or a more than 35-day cycle.
Okay. So for this one, it's okay. They should not worry for a 21-day cycle.
Yes.
Okay. So we have another question. Why is there a strange smell in the discharge during different times of the menstrual cycle, despite taking a bath?
Well, it's good to know that in the different cycles of the periods for women, you'll always have different cervical discharge or different vaginal discharges, and they may have differing smells. The key thing about vaginal discharges, one, it should be clear to whitish. Number two, it should not have any other color, like green or yellow. That is an abnormal discharge. Number two, it should not be excessive where it is going past the panty line, unless one is expectant. Expectant mothers are the ones who expect to have increased vaginal discharge. Number three, the vaginal discharge should not cause any soreness or itchiness. And then number four, it should not have a foul smell. Any discharge of foul smell must be investigated. But it's good to know that vaginal discharges across the menstrual cycle can have differing smells. But the key thing is, should not have a foul smell.
So foul smell is a health concern. They should visit a doctor.
Yes.
Okay. But sometimes, Dr. the smell may not be foul smell, but because maybe the senses are heightened at that point, someone thinks they smell. So what is natural and what is not natural? Every
woman may know her natural smell. And anytime you have a change of that, then you know something is happening.
Okay.
So it's we can't say that there's a certain smell to certain. The key thing is know your vaginal discharge smell, so that you are able to know when there is a change for the worse.
Okay. Now, there's another question. They have been itching so much around their pubic hair area, which is very uncomfortable and seem not to be going away. They have used Travacot Candid cream, but nothing seems to work. What could be the issue there?
Itchiness along the pubic hair could be a variety of things. One could also be an allergy reaction to something, maybe the shaving, or if they are waxing. It could also be due to an infection. It could also be infestation. There are some mite-like organisms called like the pubic lice, which can also cause a lot of intense itchiness. So that ideally the best thing is a client to see a doctor to get to determine what is causing this. Is it the soap? Is it the shaving techniques? Is it the waxing techniques? Is it an allergic reaction? Or is it an infestation by mites-like organisms called the pubic lice?
Are you saying we can have pubic lice?
Yep. Yes.
Uh-huh.
Yeah, they're very common, by the way.
Oh, really?
Yes.
How does someone know that they actually have pubic lice?
Usually, they have intense itchiness,
Mm.
and which does not go on anything else unless it is specifically treated.
Okay.
And when a bit of that hair is cut and put on a microscope, you can actually see those tiny insect-like organisms. They're usually very tiny, and they can cause a lot of intense itchiness.
Do they cause infection because now you have organisms around your pubic area?
No, they don't cause any infection except that intense itchiness.
Okay. Now, can a non-hormonal IUD increase discharge? And if the discharge is watery, is this one of the side effects of IUD?
Non-hormonal IUDs, like the copper-based ones, are very good methods for family planning, for contraception. One of the biggest side effects of them is that they cause slightly heavier and crampier menstrual flow. And it's also good for women to know that whenever they have an IUD or a coil, especially the non-hormonal type, they'll always have a slightly more discharge. So they need to know that that discharge is always there. But the key thing, as I said about the discharge, it should not be smelly, it should not be excessive, it should not have another color except clear to whitish.
Okay. Now, another question here. They're about 8 months pregnant. They got diagnosed with gestational hypertension. They were put on medicine, Aldomet, to handle the pressure. Do they have a hope of a normal delivery?
Yes. You'll find that whenever high blood pressure in pregnancy is very common. And it's extremely common in either the first pregnancy or older mothers, that is women above 35 years. Okay. You'll find that it tends to occur mainly after 20 weeks, if it is caused by pregnancy. And of course, there are also other mothers who have pre-existing high blood pressure. Now, we only do a C-section for mothers if we determine that the pregnancy is high risk. Maybe the baby is not growing well, or there are other problems with the mother. Maybe she has a previous cesarean section scar, or the baby's growth is not as good, or you find the baby's heartbeat is not responding well to the activity of the baby. So blood pressure on its own does not make a woman undergo a C-section. There has to be something else. Yes, maybe she has twins. Maybe she has diabetes.
So in short, she has hope for a normal delivery.
Yes.
Okay, that's good. So there's another question here with very complicated terms. How would one differentiate between a Vasa Previa and a Placenta Previa clinically in a setup where ultrasound is not available, keeping in mind that both of them happen with painless pervaginal bleeding?
It's a Vasa Previa is basically where the baby is bleeding. And yes, and the Placenta Previa is how you have a low-lying placenta. Nowadays, ultrasounds are able to distinguish maybe early when where the placenta is. And you find a good ultrasound with what you call like a color Doppler is able to determine how the placenta or how the cord, the baby's cord, is attached to the placenta. If the placenta is, if the cord is attached abnormally on the placenta, then the high suspicion that you may be having what you call Vasa Previa. And the bleeding from Vasa Previa is usually bright red. And then there is, and then usually you'll find that the baby's heartbeat initially starts with a high heartbeat, and you have compromise of the baby. It actually can cause fetal death, as compared to a Placenta Previa, which does not cause fetal death. So anytime a mother bleeds and has a low-lying placenta, it's very important to always rule out Vasa Previa, which can be checked even by ultrasound.
Okay, but in this case, they're saying the ultrasound is not available.
that can be tricky. The only other way you can get to know is how is the baby's heartbeat? Is it going up or is it going down? If there's ever a remote suspicion that could be having Vasa Previa, then and the mother is bleeding, then the best thing is that mother must be delivered immediately by C-section.
Okay, by C-section.
Yes.
Okay. Wow. Okay. Now, how can they manage PCOS? I'm suspecting this is polycystic ovarian syndrome, and can one be able to conceive?
PCOS or polycystic ovarian syndrome tends to have like 3 criteria for us to say that you have PCOS. One is you tend to have irregular menses. When you do a scan, you may see enlarged ovaries, which has many cysts. And then thirdly, you have what we call like the effects of male hormone, or what we call androgen hormone, where you have maybe like a little hair on the chin or on the chest. You may have a bit of hair loss on the sides of the head. You may have a bit of, trunk or maybe like, like a pot belly, a small pot belly, which does not go even on exercise. So any 2 of those qualify to be called a polycystic ovarian syndrome. And if you ever have polycystic ovarian syndrome, the first thing of managing it is lifestyle. Weight gain. Make sure that you reduce your weight. If your weight is high, you need to normalize what you call the body mass index through reduce your sugar, reduce your starch, exercise. If you want to conceive, then you need to be on something to hasten the conception, because it may take longer to conceive. If you do not want to conceive, then you may need to be put on maybe like a combined contraceptive pill, which helps to lessen the thickening of the lining of the uterus.
Wow. Okay, so are they able to conceive?
Yes, in fact, it's one of the best things to have for women who have infertility, because it's easier to deal with. Because if you tweak the lifestyle a bit and you put them on fertility medication, they tend to conceive much faster than the other women with infertility issues, due to maybe other reasons like the tubes, blocked tubes, or any other hormonal imbalance. They conceive faster.
That's good news. Now, when it comes to family planning, how come in Kenya vasectomy isn't widely discussed and men are not as sensitized as the better option to support women reduce the side effects rendered by family planning methods? I think this question speaks to all women in Kenya.
Yeah. Okay. It's vasectomy. It's a fantastic method, because people need to know it's a permanent method, and it is very useful because the man also bears the burden of also being responsible for planning the family. And it can be done as an office procedure. It is harmless to the man, and it does not reduce his libido or his manliness. So it doesn't make a man less of a man. It doesn't reduce his libido. The problem is that there have been a lot of myths in our Kenyan setup about acceptability of this method. People think, oh, maybe it might reduce his libido, or it may make him cold, or it may make him into a woman. All these are myths without any scientific basis. It's a fantastic method, and I will highly recommend it for couples who intend to have a permanent method of contraception.
Okay.
It's very highly accepted in the Western world.
Yeah.
But surprising and good enough is that we're beginning to see, especially the younger men, are taking it up much more as compared to the older Kenyan men.
Interesting. Now, you have just mentioned something that it is permanent. I thought some time back we read or heard of reversible vasectomy. So does that mean that there's no reversible vasectomy?
When a couple takes a vasectomy, they should know that the chances of success for reversal are very low. So that it has to be where you know that we are taking it up because we do not want children completely. Just like tubal ligation for the women, Anytime a couple is choosing tubal ligation, they need to know that chances for success are low. So that is they are low if they want to to reverse it. So it's good for them to know these are permanent methods, and it is designed for couples who do not intend to have children anymore.
Okay. Another question, what causes Prom? I don't know what Prom is. Probably you understand. Apart Prom, P-R-O-M.
Yes.
Apart from infection and multiple births. In case of PROM, is stitching the cervix necessary in the next pregnancy?
Prom, it basically means premature rupture of membranes. That's what it stands for. It is where a woman drains water before 37 weeks. So if you drain water, we even call it preterm premature rupture of waters, or we can also call it rupture of waters before onset of labor at 37 weeks. So it has many causes. The most common is infection, could be trauma, could be multiple births, especially if you have, let's say, like triplets, twins. It could also be what we call cervical, the cervix becoming insufficient. It doesn't have enough strength. This one tends to occur more in what we call the mid-trimester, where you have like a woman in her 20 weeks or so presents with painless labor. And then there, and the cervix is shortening, then those may benefit from a cervical stitch. And the key thing is about women who present with cervical problems is that the cervix tends to be shorter. It tends to form a V, or what we call funneling, and it becomes progressively shorter as you do the scans. And those ones will benefit from a stitch.
Okay.
Not all women who drain liquor or have Prom will benefit from a stitch. It has to be designed that the cervix has to be tested through ultrasound scanning and to know its length and to assess its strength.
Okay, is it possible that if it happens before 37 weeks, say at 36 weeks, that the baby can be delivered instead of going for stitching?
After 34 weeks, babies can do well. Babies above 2 kilos, that is after 34 weeks, can do quite well with support. Yes.
Okay. Now, which is the...
And by the way, for the stitching, it's best done between 14 weeks to about 26 weeks.
Okay. Post there, nothing.
After there, it doesn't help much. After that, the best thing is to have bed rest.
Okay. Now, which one is the best family planning measure that doesn't cause any harm to a lady in future? I think this question comes in place of having a lot of maybe information about what family planning can do, including causing of cancer and all those things. So which one is the best that doesn't harm them in future?
There's no harmful family planning method. The most important thing for family planning method is to go for a checkup and see what suits your needs, what suits your history, what suits when do you want to have a next baby, what illnesses are you presenting with? Because an example, if you have clots, you've ever suffered from clots, maybe like clots in the veins or in the lungs, then you should never use estrogen-based methods. If you always have extremely heavy flow, and it's not each according to their level of reproductive and general health. So this has to be determined by the doctor, and also the patient has to consent and see which works best for her needs.
Okay, so the patient has to discuss with the doctor on which is the best method for them.
That is it.
Okay, that's good. Now, a mother, para 1 + 5, is still struggling to have a second live baby. What could be causing these abortions? The mother is rhesus positive. Cervical and uterine incompetencies have been ruled out.
It depends on when she's losing the pregnancies.
Mhm.
Because if it is sometimes what could be happening whenever you have this kind of thing, there could be many causes. There
Mhm.
could be infections like things like rubella virus, things like
Mhm.
the cat scratch disease called toxoplasmosis.
Mhm.
She also needs to have issues like lupus checked, or
Mhm.
any illnesses, which is where she is attacking her own cells.
Mhm.
She also needs to have diabetes screening,
Mhm.
and even thyroid screening.
Mhm.
She'll also need to have, whenever she has lost so many of that, she'll ideally require to undergo what we call like checking of the uterus through camera called hysteroscopy.
Mhm.
Because you'll find sometimes there may be something within the uterus which is not easily seen in a scan,
Mhm.
and which can really interfere with implantation of the baby, or even further progress of the baby.
Mhm.
So it's important for that mother to undergo all those tests, and especially
Mhm.
that hysteroscopy can
Mhm.
reveal a lot of issues within the lining of the uterus.
Okay. Now, is it normal to have some pain at the lower pelvis, just like at the birth canal after sitting or sleeping? The expectant at 39 weeks, no signs of labor yet.
Yes, that is very common, because usually what happens is that when mothers are pregnant, the lower pelvis, or what you call the pelvic bone, relaxes a bit, almost like a form of dislocation, which loosens the pelvic joints. And when a mother sits and wakes up, she feels a bit of discomfort. And you may even find them walking like a duck or like a penguin because of that kind
Called
of
duck
joint.
walk.
Duck walk, yes.
Yes.
So you'll find that kind of, it's because of a normal hormones of the pregnancy, which loosen the joints in preparation for vaginal birth. So it is normal. It's normal to feel that. And usually after delivery, that pain goes.
Okay. What is your advice to alternative medicine, that is herbal, in dealing with persistent excruciating menstrual cramps?
It depends on what type of herbal medicine, because there are all types of herbal medicine on the market. There are some, so it is good to know which type. Are we talking about estrogen-based one? There are some which have a lot of hormones. There are some which are just tonics. So it is always good for one, before one resorts to them, to liaise with their doctor to see what may work, because not all of them work. Some may work, it's true, but not all of them may work. Some may even be harmful. So it is always good to liaise with the doctor and get to know which other additive, maybe alternative treatment may one use for painful periods. And there are many on the market nowadays.
Okay. Does fitness affect fertility negatively? That is a consistent fitness routine that includes cardio, aerobic exercises, and weightlifting. Does it affect fertility negatively?
What we know is that excessive exercises may make a woman not have her periods, and that can reduce fertility a bit. That is, I'm talking about excessive or extreme sports, extreme exercises. We have had, like, let's say, like marathoners, people who train for marathoners, you may find they don't have periods for some time. Women who are involved in sports may have irregular menses because of these extreme kind of exercises. Yes, to some extent, yes.
Wow, okay. But Dr. Is it also possible that when a woman becomes fit and healthy, at some point they conceive easily?
That is true. The plus side is that the more fit one is, the more you are aligned to your body mass index, the higher the chances for fertility. So that if you're doing the correct kind of exercises, you're not doing them excessively, your weight is within the body mass index, which is recommended for your height, then your fertility is much better than people who are very thin or people who are obese.
Okay. Now, what is the cause of recurrent infection? And in this point, they have put it as sepsis.
Recurrent vaginal infections?
Yes, this must be vaginal infection. Now it has become sepsis.
Okay. What we know is that untreated vaginal infections can result in maybe pelvic inflammatory disease. And two common causes of recurrent infections are, one, could be an STI, sexually transmitted infection. Two, could be the organisms which stay within the rectum or the anal region, which, because the rectum, the anal region, and the birth canal are so close to each other, they can cross-contaminate, and that can lead to recurrent vaginal infections, which may lead to pelvic inflammatory disease.
So what is, there are various causes for this one?
Yes, so there are various, so they need testing to know exactly where is the infection coming from.
Okay. Is it also possible that probably if they have a partner, maybe they are treating themselves and maybe the partner is not being treated and therefore the infection happens?
Yes, it's always good to know that anytime a woman is treated for an infection, the partner, the contact, or the contacts must always be treated also.
Okay.
Treat them both.
Correct. Does the coil make someone have longer periods?
The coil does not make you have longer periods. The only thing the coil may do to some clients is that they may have heavier, crampier flow.
And
the
why is
amount
that?
may a bit more. It's because it's within the uterus. So you find there is more irritation of the lining of the uterus. So the flow may be heavier, but the days are not longer.
Just heavy?
Yes.
Okay. Now, is there a specific plan or layout or formulas to get a baby of a specific gender? I bet you get asked that so many times.
Yeah. And there are many myths of, people have tried different ways, Chinese calendar. There are also others where you take calcium, vaginal douching, knowing when your fertile days. There's none which is 100%. So the only way you can be absolutely sure you're going to get a boy or a girl is if one does what you call like IVF, and you have what you call sex selection.
Oh, okay.
But currently that may not be allowed, but that is the only way we can be 100% sure. Other methods may improve the chances, but it's not 100%. And there are many on the, going round.
Okay, which one can you as a doctor probably suggest to improve the chances, but not definite?
I have none. I have none for now.
Okay. Because I know this is a question that women really want to know. If women were given an opportunity to pick a gender, they would.
Yes, it's true. And you always get asked that question, but you have never found one which is foolproof.
Okay.
Yes.
Now, is it normal to ovulate soon after periods, like immediately 4 days after?
Yes, you can. And it's very normal, because women who have a shorter cycle, let's say, assuming like day 21 cycle, you have a 21-day cycle. That means you'll ovulate on day 7.
Oh.
And if your periods lasted for 3 days, then
in
4
3
days later you'll ovulate.
Yeah.
You're ovulating. Yes, it's possible. Very possible. Shorter cycles mean you ovulate earlier. Yes.
Okay, someone else has had a stubborn UTI for almost 2 years. They have taken antibiotics, Levosoft 500 plus injections, but the pains in their lower abdomen has continued. They always have to keep going to the toilet for very little urine, and they get suppressed.
Recurrent urinary tract infection could be due to various causes. And this is somebody who require, first of all, to know the preventive ways of preventing urinary tract infection. One of them, of course, increase your water intake, take watery fruits like watermelon, and sometimes also use of probiotics, which are there on the market. There are several on the market, can also help. It's also important not to share toilets, to have proper toilet hygiene, know how to wipe yourself after going for a short call. So types of soap you may use. So, underwear change, all these common methods at home, preventive methods are useful. If these are not working and one is still getting these recurrent urine tract infections, then it will require a certain procedure to be done. This is called a cystoscopy.
Okay.
This is why you go with a camera and you check inside the bladder and the urethra to see what could be causing that. And maybe even take some biopsies, which will help to get to know.
Biopsies will be biopsy of what?
Of the bladder. Because when you go with a camera and you check inside the bladder, you're able to see what could be causing these kind of recurrent infections of the bladder and the urine.
Okay.
Yes, that's what she needs actually.
Okay. Now, someone else also related question. They feel UTI symptoms soon after their periods. Is that normal?
Yeah, that's common. Because most women will tend to get infections of the vagina and the urinary system after periods. This is because, of course, menstrual flow is loved by bacteria.
Oh.
And bacteria will have a field day, trying to, live on this blood and eventually cause discharges and also urinary tract infections. So it's common.
Okay. Someone else has an IUD and they have not had menses for a year plus, just spotting once in a while. Is that normal?
That's normal depending on the kind of IUD you have. Because if you have the hormonal IUD, you may even have no periods even for a year or for 6 months or for 2 years or just spotting once in a while.
Okay. Now, what would be the problem with my urine? What is the problem when my urine is stinky and very concentrated?
Stinking urine could be due to, one, is she drinking enough?
Water, yeah.
She must drink enough water because we know the solution to pollution is dilution.
Sorry, come again.
The solution to dilution is, the solution to pollution is dilution.
Okay.
So dilute with water.
Okay.
So the most important thing is she needs to take enough water. And she also needs to check whether she has a urinary tract infection.
Okay. Now, someone else, in Kenya, do you allow vaginal birth after cesarean section? And is it possible?
Yes, we do. In fact, we call it trial of labor after cesarean. It is only done for women who have a certain criteria. That means that it should only be for one previous cesarean section, not two, only one. They must have a baby who has no problems and is not a very big baby. Ideally, babies who are below 3.5 kilos. Their pelvis must be adequate to allow the baby's head to pass through. And the baby must be in a good position.
Okay.
Then we must have theater ready within half an hour, because if we need to do a C-section quickly, we need to have a hospital where there is theater.
Wow.
So it can be done.
Okay. Is it okay to receive periods for long after birth and also when on implant?
Yes. After delivery, yes, one can get a bit of bleeding here and there. And one of the side effects of the implant is sometimes spotting throughout.
Wow.
It's an annoying spotting at times. Not everybody gets that. And the key thing is it is usually spotting, not heavy bleeding. It's normally minimal bleeding, but which can last for a long period of time and which can be very annoying.
So this one of receiving periods for long after birth is okay?
If you bleed for more than 2 weeks, then you need to be checked to see what could be causing that.
Okay.
Because by 6 weeks after delivery, you should have stopped bleeding completely.
Yeah. Now, I have an IUD in situ, non-hormonal, and sometimes back I had menses that were clot-like and were abnormal more days than other days. Could there be an issue?
As I said, that if you have an hormonal IUD, your menses will be heavier and more painful.
Mm-hmm.
That is one of the hallmarks of the coil, non-hormonal coil.
Mm-hmm.
The hormonal coil causes the opposite, causes less cramping
Mm-hmm.
and less flow.
Mm-hmm.
Yes.
Okay. So you have said I need to do the uterus fallopian tube test to determine if there could be anything wrong. So how much would this test cost, and when should I come for the test, during or after periods? I think this is that's one of the questions. Yes.
The first question, yes.
Mm.
The test for the fallopian tube is called the HSG.
Mm-hmm.
It's an uncomfortable test that we do it on the 10th day of the cycle.
Okay.
It costs about 5,000 to 7,000 shillings.
Mm-hmm.
And any competent radiologist is able to do that.
Okay.
Yes.
Good. What exactly is adenomyosis, and can it cause fertility problems? Also, is there treatment for the condition?
Adenomyosis is where you have the lining of the uterus infiltrating into the muscle of the uterus.
Mm-hmm.
And typically it causes very heavy flow,
Mm-hmm.
which is very painful.
Mm-hmm.
And the pain of the flow tends to start just before the periods.
Mm-hmm.
And increases the first few days of the periods,
Mm-hmm.
and then it subsides.
Mm-hmm.
So the hallmark is heavy, painful flow.
Mm-hmm.
That's the hallmark of adenomyosis. Nowadays, we're able to diagnose it on ultrasound. A good ultrasound
Mm-hmm.
is able to diagnose adenomyosis.
Mm-hmm. Okay. Now there's a question here. Can Daktari expand on the meaning of hair loss, a sign of, I cannot remember the term he used. I think this is when you're answering on polycystic ovarian syndrome, on the hair loss sides. So can you expand on that?
Oh, it's basically the male hormone kind of hair loss on the head, maybe loss of hair on the sides, or you have hair on the chin as a woman, or hair on the chest, where we don't expect.
Okay. Now, I have a small clot towards the end of my 3rd day in my period. Is that normal?
As long as it's not painful, that's okay.
Okay. Can a woman at 50 years get pregnant and carry a baby to full term?
Yes. But you need, the problem is that after 40 years, the eggs quality is really low. Actually, the
after 40,
after 35 years, the quality of the eggs rapidly decline.
Okay, that's scary.
And by 40, the quality is really, really low. So you'll find that, yes, that woman can carry a baby, but you're using somebody else's eggs.
What do you mean?
What we call donor eggs.
Oh, okay. At 50 years now?
Because by 50 years, the eggs are quite low and the quality is very low. So she'll need to borrow eggs from somewhere, somebody younger.
Okay, but Daktari, we have seen women who at 55 still conceive and deliver babies. Does that mean the babies are born of low quality eggs?
No, it's what I'm saying is that it's difficult for you to conceive after the age of 50.
Okay.
Those are the exceptions.
Okay.
But if one wants to conceive, then the best thing is they'll need to do IVF and then use borrowed eggs.
Okay. Okay. I get you. Thank you.
Yeah.
Now, why is it that most doctors refuse to perform tubal ligation for clients under 35 years, even if they have achieved the number of children they want? And can a lady be done undergo a tubal ligation without involvement of the husband?
Very good question, because we face a lot of those questions every day.
Yes.
You'll find that most women may experience regrets, especially if they are below 35. That is why sometimes we advise them to really think very seriously about this, because we see a lot of women, especially between the age of 38 to 42, having what we call like a baby fever. They want to have another baby, yet they did tubal ligation at 32 years. So it's important that to know that tubal ligation is a permanent method, and to know there are other methods can be used, which are long-term, like the coil or the implant, which are also reversible. Number two, the tubal ligation nowadays, the woman is the final say, because that is her body.
Yes.
And is recognized. She can do it without the consent of her husband. Although to maintain harmony in the house, it's always good to have the husbands in the know.
Okay. That's important, ladies. Please, to maintain harmony, seek consent. Now, someone else has been using Depo-Provera for about 7 years now because they have very painful periods. What are the long-term effects of using Depo for long?
Depo-Provera is a good method. It's a very common method used. But it's good to know that Depo should not be used for a woman who has never had children. Number two, sometimes it can also cause thinning of the bones if it is used for a long period of time. So it will be good to supplement with calcium or vitamin D. It can also cause the periods to, not to get periods, which is not a bad thing. Or you can get spotting once in a while. Or some people may report increased weight gain.
Okay.
Yes.
Okay.
And also, if you want to conceive, one may take slightly longer than other methods. Yes.
Okay. Now, can one inherit period pains from her mother? And can this period pain last until you get to your menopause?
Yes, it can happen. We can see sometimes painful periods can run in families.
Oh, okay.
Yes, it's possible. Yes.
And can it last until they get to menopause?
Yes, it can happen. But as I said, after the age of 21 or 25, if you have painful periods, it's good to be checked for other problems like endometriosis, infections, scarring of the uterus. It's good to make sure that there's no other cause which can be sorted out.
Okay. How long does it take for one to get pregnant after removing an implant?
Implant is very good because within 72 hours, one is ready to conceive. So it has a shorter latency. All implants, whether the 3-year one or the 5-year one. Within 72 hours, their menstrual cycle is back to normal. They can conceive.
Now, a very important question here. What causes painful sex?
Painful sex will depend on a number of factors. If it is what we call painful sex dyspareunia, and it can occur if it's superficial, that is at penetration, then the causes could be more issues like infections, the commonest cause, infections of the vulva. But if it is deep, if the penetration is deep and you're having deep pain, then there are other causes like endometriosis, infections, which can cause that. It's always good to know what kind of dyspareunia or painful sex do you have? Is it on deep penetration or at superficial penetration?
Okay. Now, Dr. Is it possible that the painful sex can also be caused by some forms of cancer?
Yes, it's possible, but it's rare. Yes.
Okay.
But common things occur more commonly.
Yeah. Now, what causes back pain mostly after giving birth through cesarean section?
I think back pain, I think it's good to know that cesarean section doesn't cause back pain, but back pain is said to be caused more by poor posture after, during breastfeeding. Because you'll find that most women, if you do not support your back when you're breastfeeding, because of one reason or another, then you'll have your back aching. So it's always good before you breastfeed your baby, make sure you have supported your back and you have brought the baby up to you, not you going down to the baby. Bring the baby up to you. So you can use some of those aids like the breastfeeding pillows, which help to elevate the baby.
So it's not the cesarean section or the surgery that causes back pains?
No, it's not the cesarean section.
Okay. Now, is it true that fertility reduces from the age of 30?
Yes, that's true.
Really?
Yep.
You know, at this the current world, women start giving birth from age 30.
There's from age 30, there's a decline in the eggs. And after 35, the decline is even faster. Yes.
Okay, so ladies, you're encouraged to try and give birth before 30.
That is very important.
Okay. I was told that my period pain will disappear, reduce after giving birth. It did, but just for 3 years. Now it's back. Does it mean that when I give birth again, I will have the pain reduce?
It is possible. But it's also possible that she could also be having something else which is causing that period pains, which needs to be investigated by the doctor. Okay. Could she be having endometriosis? Could she be having swellings of the ovaries? Could she be having fibroids? It needs to be checked. Okay.
Now, I was told that my period pain, okay, that one we've answered. I'm in my mid-30s, no child, and with very light period of about 2 days. Is there a chance that I will not be able to get children?
You should get your children well. But it's always good to go for an assessment to see your fertility potential.
Okay.
And there are tests for hormones which can be done. There are ultrasounds which can assess the womb and even the lining of the womb. So if you have questions on that, that can easily be assessed. Okay. But it's possible she can still get her own children.
Okay, that's good news. Now, someone else has hair loss, alopecia, and they also have hair on their chin and around their nipples. What could that mean?
Possibly that is what we call Hasidism.
What?
Hasidism, Hirsutism.
Okay.
This is where there's a hormonal imbalance of the male hormone, where you have hair in areas where you're not supposed to have hair. Like for women on the chin, losing hair, hair on the neck, hair on the chest. So this is called Hirsutism, and it's a hormonal imbalance that is need to be checked because it's treated. It can be treated.
Okay. Good. How soon should one conceive after removal of fibroids?
Within 3 months.
Okay.
Within 3 months, one can conceive.
Okay. Now, another question, I think just related to the sex question you had answered. If one feels deep penetration pain, can it be fibroids?
It's possible, but the commoner problem is something called endometriosis or adenomyosis.
Okay, which you have described.
Yes.
Okay. What causes low desire for sex, especially if one was sexually active before?
For women, low libido is a cause. Could be due to many things. It also could. Many women experience higher libido when they are ovulating. And sexual function, libido in women is more of a psychological function. So if there's something bothering them, if they are stressed at work, stressed at home, stressed with the baby, they have just delivered, they're on hormonal therapy, something is bothering them, then the libido goes down. So usually it's always good to assess their emotional and psychological well-being before engaging in other, maybe something else could be causing the low libido.
Okay. Now, what is the main cause of the rising cases of fibroids?
We know fibroids are 9 times more common in African women. And the commonest cause for fibroids is lack of babies.
Oh, okay.
So that women are having their first baby later in life, and they're having few babies. And then there are also, blacks, Africans, who we have a higher genetic predisposition towards getting fibroids. Yes.
Oh, okay, okay.
So black women are more predisposed, that is Africans, to getting fibroids, especially because of having fewer children and starting late.
Okay. Now there's one here with good news, but I think she's puzzled. The husband did a vasectomy, but they still conceived. So how did that happen? Yeah.
It's good to know that if you do a vasectomy, you need to stay for you have to do 3 months using a protection, because the sperms don't disappear immediately. And you have to go for a test after 3 months to ascertain that there are no sperms in the semen. So maybe if they had unprotected intimacy within that 3 months of period, then it is possible to conceive.
Wow. Okay. Now, with a bilateral tubal ligation, can IVF be used to conceive and carry the baby to term?
Yes, it can.
Okay, good news.
In fact, for women who have had a bilateral tubal ligation and they want to conceive, then IVF is a method of choice.
Okay. There's a futuristic question here. Is it possible to have eggs harvested for future use?
Yes. Nowadays,
is it happening in Kenya?
Yes, it can be done. Some few IVF centers can do that. You can have your eggs harvested and preserved for use later.
Okay.
Yes, it's possible.
Good. Now, what causes hydrosalpinx? I don't know what that is, so you must know. What causes hydrosalpinx? Maybe you know?
Hydrosalpinx is where you have the swelling of the fallopian tubes, usually due to an infection.
Okay.
It's almost always due to an infection. Yes.
After HPV test was positive, I was asked to take a pap smear, and the result was good with an inflammation, which the doctor said was ocno malignancy. Is this good enough? Should more tests be done?
HPV testing is what we call human papilloma virus testing. And nowadays we look for what we call the oncogenic types. That is the ones which are likely to cause cancer.
Okay.
If they are not there, then we are happy. And the pap smear comes out as no abnormal cells, then that client should be a happy client. But if you have the HPV showing that you have viruses which are called oncogenic, then that patient needs to be followed up closely.
Okay. Now, there's another one. A dermatologist advises that they get more children to have hormonal balance. This is because they have eczema and acne. Is this true?
Possibly, maybe she could be having polycystic ovarian syndrome, maybe.
Okay, okay.
Yeah, maybe.
So if they have that, then having more children would balance their hormones?
It is neither here nor there. Yes.
They need to come and see you so
Yes.
that you can take them through. Okay. If you get someone's eggs, then what's the genetic make of or DNA of that baby? And then if one has fibroids, how easy is it to conceive?
Fibroids depend on how big they are and the position they are in. Fibroids which are inside the womb, inside completely, will interfere with conception a lot. What we call submucous fibroids. That is fibroids which are on the lining of the uterus. They will leave no room for the baby to implant. Also, very big fibroids which are bigger than, the uterus size of more than 14 weeks may need to be removed so that it can free the womb of such swellings. So it's important to know that location of the fibroids and the size of the fibroids can affect fertility.
Now, someone else is asking about epidural. Is it happening? Is it advisable during birth?
Yes, it's very common in the private hospitals. It's offered. It causes complete pain relief, and it is given during when you have the active phase of labor from 4 centimeters and above. Then the thing is, sometimes during second stage, during delivery, you may need to have what you call, vacuum delivery to allow, just to facilitate the baby coming out. But yes, it's being offered.
Okay. Now, is it normal to have abdominal pains even when they are no longer on their menses?
It is not normal. Maybe once, yes, but if it becomes a recurrent problem after menses, that problem needs to be checked because it could be an early sign of endometriosis.
Now, still on adenomyosis, does it cause fertility problems?
Yes, adenomyosis can cause pregnancy losses. It can also cause reduced fertility.
Okay.
So it needs to be managed.
Okay. Now, as a doctor, can you recommend safe days method than family planning? And how safe is safe days?
Safe days are not 100% effective, but they're effective. It also depends one also needs to know their cycle length.
Okay.
And luckily nowadays we have the apps on our phones, which can help us to track. So they increase your contraceptive effect, but they are not 100% effective. That is the safe days used alone.
Okay. Now, for people who have irregular menses, can safe days be recommended?
Safe days are recommended for when you have regular menses.
Okay.
If you have irregular menses, they may not work well.
Okay. Another interesting question, is it healthy to have sex while on your periods?
It's messy, but it's not unhealthy. Yes.
Okay. Now, what is the most appropriate fluid in management for PPH/APH?
For PPH or APH, the best thing is if one is bleeding very heavily, then you need to have blood ready. You need to transfuse blood. Otherwise, you can use IV fluids like normal saline or Hartmann solution. Yes.
Now, when should one start taking folic acid, and must one take them if they are eating healthy?
It's very important to supplement folic acid in pregnancy. It's important to supplement folic acid. At least the first 3 months of pregnancy, or even a month before. Yes.
Now, what type of family planning would you advise a woman who has conceived on Depo and the coil at some point? They had Depo, they conceived, they had the coil, they conceived. So what family planning now can they go for?
The other methods one can use, there's the pills, you can have the implants. I think I'd advise on the pills and the implants.
Okay. Now, is it true that staying with the cool, I think that must be coil for more than 8 years can have delays in conceiving when removed?
The coil does not cause delays in conception. Actually, the moment you remove the coil, one is immediately fertile. Yes, so coils do not delay fertility unless one has an infection.
Okay. Now there's someone else here. I know this question probably was answered in some of the question, but this looks like a distressed question. They cannot get pregnant for 3 years. All tests have been done. They have irregular periods, but their partner has never been tested.
They would like to conceive.
Yes, they would like to conceive.
I think they need to be tested. Anytime a couple is going for testing for fertility, it's so crucial for that couple to have both the man and the woman tested. And for the man, we look for the sperm count. For the woman, we look at how is the womb. Does she have a womb or not? How is the womb? How are the fallopian tubes? Are they open? Is she ovulating? Is she releasing eggs? How are the hormones? So it's important for both of them to be checked, because fertility is a dance of the two. So we need to have both the man and the female tested.
Now, again on fibroids, they have not had children, but recently they were found with a fibroid. Is it something they should worry about?
Fibroids tend to occur in our women as they grow older. It should not be something to worry them about. And when they are small, one can still conceive with them. So there is no problem. Fibroids are only a problem if they are large or they're inside the lining of the womb. That's the only time they cause serious problems like bleeding or pregnancy losses.
Okay. Someone else had an implant for 9 months. They didn't have any periods for the first 3 months. After 3 months, they started spotting for long. It would continue past 3 weeks. They were advised to take microgynon together with some drugs that temporarily stopped the flow. The spotting is back. What can they do?
They need to go and see their doctor, because that's a common side effect of the implant. And they can also try the progesterone tablets, like for 2 weeks, to try to create a new cycle. If that doesn't work for maybe 2 or 3 times, then the best thing would be to remove it if it is really causing them problems.
Okay. Another question on Rhesus gene. They have a negative Rhesus gene and they didn't get a shot when they were supposed to during their second pregnancy. So if they want a baby, what are they supposed to do?
All Rhesus negative mothers need to see their doctor before they conceive, and also immediately they conceive, because there are tests which are done which help to determine whether she's sensitized to attack her own baby. And it's important for those tests to be done immediately she conceives, and also at 28 weeks when she needs to be tested again before she gets the anti-D jab.
Okay.
Of course, at delivery, the baby will also be tested to see the blood group. And if the blood group is different from the mother, then the mother needs to get another anti-D.
Now, someone else wants you to shed light on Evra patch, family planning option. It seems not common.
Evra patch is a fantastic method for family planning. It works well. It is attached to the skin, and it is used weekly. It's like a skin patch, which you apply on any side of the body, and you change it every week. That is 3 times in a row, and then you rest for 1 week. It's a fantastic method. It's a bit expensive because it may cost you about between 800 shillings to 1,500 shillings per month, but it is quite good.
Okay, I can see we still have a lot of questions, especially on area of fibroids, and our time is running out. So maybe we, as an area of interest during our part 2 of this discussion, we can really delve into fibroids, and then you can explain everything fibroids. But there's a question, some few questions here, about 3 or 4 I need you to answer. Progesterone is essential for maintaining pregnancy, if at all fertilization takes place. Now, why are women injected with Depo-Provera as a family planning method, given that it is a progestin derivative? Just shed some light for general knowledge.
All those methods you hear are hormonal methods. They're basically using the female hormones in the body, because the main type of hormones in the female's body are estrogen and progesterone. So we basically work with those two to reduce fertility or to enhance fertility.
Mm-hmm.
So if we want to reduce fertility, we can use a progesterone, or we can use a combination of estrogen and progesterone.
Mm-hmm.
So it's basically use the hormones which are similar to what the woman has in her body for her to achieve contraceptive effect. So it is not something external really. We're just using the same physiology of the hormones she has in her body.
Okay. Someone else is asking if one's uterus has been removed because of fibroids, but the ovaries, but they still have their ovaries, late 40s, over 50 years. Is it necessary to keep doing pap smear? And if so, after how long?
After the uterus is removed and the cervix has been removed, because that is very important. You don't need to do pap smears if the cervix has been removed.
Okay.
But if the uterus only was removed and the cervix was left, then it's important to continue doing pap smears.
Okay. Now, an interesting question here. Is it true that vagina smell is related to what you eat? For example, you eat pineapple, the vagina smells pineapples.
It's possible at times.
Wow, okay. So eat pineapple. Now, a follow-up question.
Yes.
Is it true that after fibroids removal, I could have a scar tissue that might prevent implantation?
Sometimes it can happen, especially those fibroids which are within the lining of the uterus. The uterus sometimes can heal with scarring, but luckily nowadays we are using anti-scarring medicines when you're doing fibroid surgery to help such an event occurring or to minimize such events occurring.
Okay, how much does it cost to have eggs harvested in Kenya?
I don't have the exact amount, but maybe anything between 50,000. And also there's a storage fees per year. Yes.
Okay, can one get pregnant while taking the Dronis pills? And if so, what could have happened?
The Dronis pill is a fantastic pill because it's taken 24 and then you stay for 4 days. And yes, one can conceive if it is not taken in the correct manner.
Okay.
If one forgot a day or two, then because anytime you're using a pill for contraception and you forget, it is important the following day you take 2.
Okay.
But if you forget more than 2 days continuously, then that means you're not serious with that contraceptive. That means you need to wait or use a protection like condoms.
Okay. I'm combining 2 questions here. Is it normal to have a 20-day menstrual cycle? And is it normal to have a cycle in 36 days?
As we said, the normal cycle is 21 to 35 days. And how you calculate your cycle is from day 1 to 1. Day 1 of this cycle and the day 1 of the next cycle. That interval must always be between 21 to 35. 20 days is abnormal, 36 days is abnormal.
Now, I think there's a question on clothes during periods. I think that one will answer during our next session together with the questions on fibroids. There's I have 2 last questions, but there's one here who's a 51-year-old who is trying to conceive. They want your contact so that they can pursue this further with you. So the doctor will share the contacts after this so that you're able to reach out to him. And so the last question of the night before we close is on orgasm. What causes one to take longer to orgasm?
Orgasm is what we call the climax of the female sexual cycle. But it starts with the arousal, then you have the plateau phase, then you have the orgasm space. Then after that, you have what we call resolution. So those are like the steps of the sex cycle. You start with arousal, then there is what we call the plateau phase, then you have the orgasm, and then you have the resolution after the orgasm. Not all women may may get orgasm.
Okay.
And also, they may also depend on also different when her cycle is, because you may find some of them may get their orgasm during when they're ovulating, or maybe also when she's more relaxed. Because if she's a bit more stressed, she may not get it. After delivery, she may not get it immediately after. Or if she's using some hormonal methods, she may not get, or she may get with this partner and then not with another partner. So female orgasm is dependent on so many factors. Even where she is she in a different environment? Is she comfortable where she is? Does she feel safe? So it's female orgasm is dependent on a lot of psychological, emotional, and even physical aspects.
Okay. So, ladies and gentlemen, I think we need to stop there because of time, and Dr. also still has patients he has to look after this night. So thank you so much for joining us. A lot of our questions have been revolving around fibroids, around menstruation, around sex and conception. So this was part 1 of our 3-part series. In part 2 and part 3, Dr. will try and address issues around the major topics that have been discussed tonight, so that they can shed more light on some of your questions. For those ones whose questions have not been answered, I'm going to share those questions with Dr. so that he can include them in his presentation next time. Otherwise, thank you so much for joining us tonight. Dr. I want to give you time because I know there are some people who want to know how they can reach you, where you are, your contacts, so that you can share your contacts before we finally close.
Okay. Thank you very much for the viewers and the listeners. I'm based in Hurlingham, that is Janku House. Our office line is 0720 432 634. That is Nyaku House, Hurlingham, 1st floor.
Okay. I hope the ones who want to reach out to Dr. can reach out to him through that number. So ladies, and I can see some gentlemen who have also joined us. Thank you so much for creating time this evening. This is a very important session. Looking forward to next week when we are going to have our part 2, and the other week when we're going to have our part 3. So if your question was not answered tonight, please look forward to the next time. Thank you so much, Dr. On behalf of everyone who joined us tonight and on behalf of Air Insurance, I'd like to say thank you so much for creating your time off your schedule to come and talk to us this evening. It has been very enlightening and very important. So thank you very much.
Thank you.
Good night, everyone. Thank you. You can now leave and go and continue with your day activities. Thank you.
Thank you.